Already the 6th episode of the series organized by the UK Degrowth Summer School team as a temporary replacement for the postponed physical summer school. This particular webinar is held as part of the Global Degrowth Day, which was last Saturday on June the 6th, and saw nearly 40 public events promoting degrowth as a path to global life for all. Oh, to a good life for all, sorry. So we're celebrating the day with a small delay, but still committed to its spirit. This webinar is supported by a super team of Kat, Lorenzo, and Gabi, who are helping off-screen with the chat, streaming, and Twitter. And I'm Oksana, I'll be facilitating this discussion. The title of this session is Growth, Degrowth, and Health. As we all know, improved health and life expectancy are one of the most common arguments in favor of economic growth. And today we aim to discuss if it is a valid one, and we'll try to unpack the complexity of the relationship between economic growth and health. We will also, of course, discuss the COVID pandemic and the place of health in the degrowth discourse. And we're very lucky to have with us today 3 great speakers, Jean-Louis Aillon, Iris Borowy, and Panayota Kotsila. As usual, we'll start with opening talks by each speaker in which they will touch upon different aspects of today's topic, and then we'll continue with the discussion. If you have any questions, please post them in the chat, and make sure to check the video description for some very interesting readings on the topic. Sorry, it's a little bit cramped, and we had to fit a lot of links into a limited space. And finally, we expect the webinar to last for about 1 hour, 40 minutes. Without any further delay, let me introduce our first speaker, Jean-Louis Aillon. He's a medical doctor and adlerian psychotherapist and works as a clinician at the Frantz Fanon Center in the field of ethnopsychiatry. He holds a Ph.D. in psychology, anthropology, and cognitive sciences from the University of Genova and is the spokesperson for the Italian Network for Health and Sustainability. His research areas are mainly focused on health, youth, and degrowth. He's also an activist and practitioner in the Italian Movimento per la Decrescita Felice, as well as the support group of international degrowth conferences and international degrowth activist group. Jean, the floor is yours.
Thank you very much. Thanks for the invitation. So I have to share, while sharing the screen, I can say that I'm happy to speak about health. When I went to the first summer school of Degrowth in Barcelona, and I thought that I was a doctor, every people, it's okay, live screen, told me, why are you here? You work on what's to Degrowth? No? Nowadays, everybody will agree probably that Degrowth matters with that, but is what I will try to talk about, starting from the determinant of health. What is health? It's difficult to define. Probably there is not a definition. Health is a social and a cultural construction. But what we can say is that there are different dimensions in health. There is not just the physical one, and health is not just the mere absence of disease, but is a state of physical, mental, and social well-being. And in this line, we know what are the main determinants of health. And there are not the healthcare services. Healthcare services account for from 10 to 25% of our health, while the most important determinant of health are the social, 50, and the environmental. General condition, no? So the place where we live, where we work, our education, how we grow our food, water and sanitation, housing, social and community network, and our lifestyles. The most important determinant of health are the social one. And Marmot, in the famous World Health Organization report, say that social justice is a matter of life and death. And I will give you some examples. Basically, the social economic context influence some structural determinant of health is the socioeconomic position, social class, gender, ethnicity, education, occupation, income. And this factor influence the risk that we have to get sick and to have a good cure. So influence our health a lot. Our society nowadays is not really far from the situation of the Titanic, where the mortality of the first class was 40% and of the third class was nearly 80%. We have, if we measure health on population, what we call a socioeconomic gradient of health. And you can see that the rich has less probability to have worse outcome of health compared to a routine occupation that have nearly three times higher risk. And similar data I could show on education, on income. To have a data between a laborer and its director, we have nearly 5 years of difference in life expectancy, caused the social determinant of health. There is a difference between North and the South that go from 40 years to 80. But also within Western societies, could be a lot of difference. In Glasgow, we have 20 years of difference life expectancy in different neighborhoods. Or in London, if you go from Westminster to Cannon Town to the suburb, people lose at each stop of the tube nearly 1 year of life. We go from 77 for male to 71. But it's not just something about life expectancies. It's also about disease. Here you can see in the United States the prevalence of poverty that are the same zone of the prevalence of diabetes. And but it's not really income or the status by itself that influence mostly our health, but is equity or inequalities. And so relative deprivation. Also, if everybody is more rich, but the rich are more and more rich than the poor, is not good from the health. And here you can see, for example, here you have society with more problems of health, and from the left to the right, you have more unequal society. And you can see as United States that invest mostly of the double of the Western country in health as one of the poor outcome related to health, because it is a very unequal society. And social determinant of health take also infectious disease. For example, if you see now the cases of COVID and the race, there is a content that we can criticize, but let's do it. You can see that white people have almost the half of possibility to have COVID than the Hispanic and then the Black African people. And if you see the death and not just the cases, this difference become more big. Is probably more than a half. These are data from New York. And you can see that also for an infectious disease, there is a socioeconomic trend. So people that are more in a state of poverty get more sick. So unfortunately, probably we can say that the structural violence, a concept developed by Paul Farmer, kill more people than the police. And that this is the main explanation, racial discrimination, but mostly poverty of the population that are Black in the United States. Social, environmental. Also, these data are relevant. In the world, every year we have 30 million of deaths caused to the environmental factor that we could avoid. 9 million are about pollution, more than malaria, HIV, and tuberculosis, 15 times more than the victim of all wars. The 23% of death in the world. Stroke, ischemic heart disease, cancer, they kill mostly the vulnerable, the old people and the baby. And mostly is the data from pollution in the south. Why the biggest global health threat in the next century will be climate change. 250,000 more deaths per year. And finally, we have the culture that is colonized, Serge will say, by this model: consumerism, individualism, stress, lifestyle more fast, and that influence our health. So what about growth and health? Sure, it has been in the last centuries a positive relationship between GDP and life expectancy. But probably Iris will talk better about. This is called the Preston curve. But Preston himself explained that only 10–15% of this curve is explained by income. The rest come from exogenous factor. And this curve doesn't take into account the externalities, so the cost of the exploitation of the South and of the future generation. So it's not really just the income, but as we said, inequalities as very important. Moreover, after a certain threshold of development. And so the concept of relative deprivation. As you can see here, you have the spending of the United States, more of the double, as I said, of the most of the Western countries, but the life expectancy of United States, even if they spent more than 15 times money than Cuba, is similar to the Cuba one, because Cuba is more an equal society. And so we say also in the medicine field that doing more does not mean doing better. This is an international campaign, medical one. And if we see some data, we can see that after a central threshold, the contribute to development to health reduce, diminish marginal returns. And if we go to an income yearly of 30,000, the curve became flat. If we go more to 40,000, it began diminishing, probably because this society have huge inequalities to have this kind of income. Furthermore, what we know, I will go quickly because there are a lot of data, growth, even if here after a certain threshold, is not sustainable, no? And will cause a lot of problems. Climate change will be the most important health problem in the world and is related to growth. But basically, growth is based on two factors: exploitation of human and natural capital. The natural produce environmental damages, while the human produce inequalities. And this system produce bigger inequalities from 70. From north and south, but also in the Western world. And finally, growth doesn't make happiness. We know is the paradox of Esterlin that GDP grow, but well-being remains stable or diminish because everybody work, has no time for relationship, and so the well-being become less. Finally, we know that green growth is not the solution. And thus, for achieving sustainability, we need, in my opinion, a process of degrowth. And this is why degrowth is crucial for health. Because if the 60% of our health depend from environmental and social determinants, and we know that nowadays, this system that gives less and less to health and is not more able to grow, is continue to exploiting more and more the main determinant of health. And so it's not feasible to protect health within this system. But as the Italian Network for Sustainability and Health quoted, is to protect health is important to build an alternative model of society, not only aimed at growth. And in this line, we can see how the objective of degrowth, environmental sustainability, social justice, and well-being are the pillar, the main determinant of health, and so how a degrowth transition would be beneficial from an health point of view. Here, it's an develop with here Iris of some examples. A lot of measure of degrowth could be helpful to health, reducing inequality, fewer working hours, relocalizing economic life, reduce the general output of material consumption, etc. But what I would like to stress is this second point, that health is also crucial for degrowth. And it's not a chance that Ivan Illich, in Tools for Conviviality, a pillar book for the degrowth theory, explained the two watershed, taking the medicine as an example. Illich said that when a tool-based activity exceeds a threshold defined by the ad hoc scale, it first turns against its end, and then it threatens to destroy the entire social body. So a lot of activity, medicine, cars, education, after a certain threshold, become less productive, and that is the first threshold. Illich put it in 1913 for medicine, when the population starting to feel dependent on doctor. And after the second threshold, the second watershed, we have what you call counterproductivity. So the damage is growth, and the activity became counterproductive. And he said that in 1955, we could discuss about these days, I do not agree, but from a certain point, doctor assumed the control over the patient entire life. Medicine became a major threat to health because the excessive development of medicine caused what we call iatrogenesis. That is the damage made by the clinician. Iatrogenesis can be clinical, so damage of drugs is a phenomenon quite big. In US, is the third leading cause of disease, but is also a social and cultural process. Social iatrogenesis for Illich is when health policies reinforce an industrial organization that generate ill health. Such medicine is but a device to convince those who are sick and tired of society that is they who are ill, impotent, and in need of technical repair. And this concept has been developed in times by medical anthropology and the sociology of health that underline as medicine is often a tool for social control, acting through different mechanisms. One of these is reification. Taussig explained like the biomedical system operates these reification processes that reframe socioeconomic factor, human relationship, people and their experiences as things, res, object, and true facts of nature. And this contributes to the construction of a social reality that aims to preserve a particular political order, reintegrating suffering people in a shared order of meanings, and thus cancelling out the social, economic, and political dimension of disease. We see that diabetes, but also depression, is very related to the inequalities. But our biomedical system does not tell this disease like inequality disease. The name is diabetes. Depression is a problem in your cells, in the pancreas, in the brain, serotonin, and to cure this problem, you have to take some pill. No? So it's a sort of process that avoid the social and political dimension. No? People are not angry. They search a cure from the doctors. And so it's avoid this part that with a different name could be a different sort. And doctor act as readapt people to a sick world more than the contrary. And we can think with the pandemic. What is the real cause of pandemic? COVID-19, a virus. No? So the cure is the vaccine, is the future drugs, or it's growth, development, loss of biodiversity, intensive animal farming. Panayota will talk about. But naming differently, put evidence on the society, or to change the society, or to find a cure. If we could call the grow pandemic, maybe, and things will change, maybe. And that's a bit what has been developed by Foucault, when he talked about biopower and biopolitics. No, a sort of microphysics of power that we do not see, but shape ourselves and our body to the imperative of the normality, producing subject and practicized body, docile body. And we could question ourselves what is happening with coronavirus from this perspective. In this sense, I think that, as Illich quote, a revolution in a health field to search autonomy for ourselves and for our society is crucial for a degrowth transition. We talk a bit, we wrote a bit about that with Giacomo D'Alisa recently, trying to develop in an alternative way to conceptualize health, decolonize the imaginary of health from the current view, and trying to imagine how the growth frame could transform health services, putting at the center social and determinant of health, and thus health promotion, and mostly involve citizens in health promotion, in making health at the community level first, because this kind of revolution is not a professional task, but mainly a political one. Thank you very much.
Thank you very much, Jean. I'd like to hand it over to Iris. So our second speaker is Iris Borowy. She is Distinguished Professor at the University of Shanghai and Director of the Center for the History of Global Development. She received her Ph.D. from the University of Rostock, Germany, and has worked at various universities in Germany, France, Norway, and Brazil. Her publications include Defining Sustainable Development, for Our Common Future, a history of the World Commission on Environment and Development. At present, she is working on a project on the policies of international organizations regarding waste. Iris, the floor is yours.
Okay, thank you very much. Yeah, thank you very much also for this invitation. I feel quite honored, and I'm very happy to be on the same panel with Jean-Louis after we co-wrote this paper years ago. And they're very complementary. So I also start with the idea, what is health? You already mentioned the definition by the WHO, the state of complete physical, mental, and social well-being. Now that's something that is very difficult to operationalize when you want to know if health is actually getting better or worse. So two measurements that are frequently used, to use that also, is physical height and life expectancy. So I'm a historian by training, so I will talk a little bit about how this has developed over time and what this says about economic growth. Height, how tall we grow, is a reflection of how healthy we are. That is how well we are fed, of the nutritional status, and also the disease burden, and generally the health circumstances when we grow, so during childhood and during adolescence. And this here is the information we have from skeletal remains from Europe of the last 2,000 years. And so what you see, that really nothing has changed very much. Men in Europe over really 2,000 years sort of grew more or less the same until about 1.70 meters. Until relatively recently, that's the last 200 years, last 1 or 2 centuries, which is, if you look at it, also the time that we see immense economic growth. This is the time when we see world GDP rising, without precedence. We've never had this type of economic growth. Now, if we look at this in more detail, this is how the average adult height by year has changed in the last 100 years. You can see that really, this is the data around the world. So this is very general, but it's also true for everywhere in the world. People have grown taller, and on average by about 10 centimeters, both men and women. This is immense. This is, as you said, if you look at it from a historical long-term view, this is really quite spectacular. You also see that actually it was even less than 1 century, because this process has pretty much come to a standstill after the 1970s and 80s. And even for males, it seems like it's reversing a little bit. So this, just as a reminder, just because we are growing healthier, we're growing taller, and clearly world population has become healthier, and it's probably healthier now than it ever has been in history, at least since the Neolithic, doesn't mean that this is not reversible. This graph can change again, and if we don't retain the conditions for healthy lives, we can grow shorter again. It also doesn't mean that these benefits that we've had, that they were experienced similarly everywhere on Earth. So these are 4 countries here. If you will look at the United States, at the beginning of the 19th century, American men were probably the tallest in the world, for all we know. And then they actually became shorter, which is interesting because this was a time of economic growth in the US, and then grew a lot taller again, but they were absolutely dwarfed by Dutch men, who are today the tallest men in the world. You have similar developments here in China, especially since the 20th century. This is Ghana. What you can see here is that colonialism is not healthy. Men became a lot shorter after the beginning of colonialism, but also independence hasn't been quite as unhealthy, but also not quite as healthy as maybe people hoped. The situation for life expectancy is really very similar. So I'm going to go through this a little quickly. This is the world here, the orange line. Also, life expectancy has increased a lot. It has basically doubled in the last about 150 years. Also unequally, but everywhere. Again, the Dutch people are not only the tallest, they also live very long, longer than Americans. China has been catching up enormously. Ghana, as you see, also is still, people in Ghana don't live as long, but also have increased enormously. Everywhere in the world, people are living longer and people are living healthier. So this is an immense change.
I think we just lost Iris.
Yeah,
Iris,
I can hear you. This is I can hear you. Can you hear me again?
Yes, yes. Can you resume your presentation?
This is exactly what is not supposed to happen in these events. Okay.
It's okay. It happens.
Let me just ignore this. Okay.
Shouldn't
So
happen.
why did this happen? And I have here the Preston curve also that Jean-Louis already had. That correlates per capita income with life expectancy. And as you already said, if you look at the countries, there's a very clear correlation that is countries that are wealthier, people in those countries live longer. But of course, I wouldn't be sitting here if I thought that was the entire story. So actually, I wanted to go to the internet and show this little video, but actually, I think I don't dare do this now. The interesting thing is that if you look at this,
Iris, sorry, can you share your slides again because they're not showing now?
Okay. Are we there now?
Yes, thank you.
Okay. Let me go here. So this is the Preston curve. Can you still see this now?
Yes, yes, thank you.
Okay. So please keep this in mind because the correlation is very strong and very clear, and you can do this for any year in the last century and the result will always be the same. It is not the same if you look at development over time, you can see a development. Okay, this is the same thing over time when you have the correlation, and you can see a direct correlation in the US starting in about 1930s, in the Dutch case in about the 1950s, in China round about the 1970s or 80s. Before that, what you see is a very erratic, chaotic development with not a very clear correlation. And you can here see an example of the Great Depression in the 1930s. What you see here is the unemployment level. This here is GDP. So this is the Great Depression in the United States. And here's life expectancy. And quite counterintuitively, the higher the unemployment, the lower the GDP growth, or the higher GDP shrinkage, the longer is the life expectancy. So the data we get are really quite contradictory. On the one hand, we get very clear data that show a correlation between high income and good health, and we get the contradictory data as well. How can I explain that? Again, I can build on that, on what Jean-Louis already said. The trouble with health is that's very, very complicated. It depends on a lot of factors. I mean, these are really quite a lot already, but they're by no means all. This is not an exhaustive list. On an individual level, it depends on what we eat, depends on our living conditions, working conditions, the stress level, leisure time. Do I even have leisure time? Social contact, super important. Do I have family and friends? The best thing, apart from living, eating well and having a roof over your head, the best thing you can do for a long life is having a happy marriage. Some things are within our control. Do we smoke? Do we drink alcohol? Do we have safe or unsafe sex? Some things are beyond our control. Our birth weight. So the conditions that we lived in before we were born will have an effect on throughout our lives on the health level that we have. Similar things are true on the societal level. Is there available and affordable food or healthcare or contraception? Is there a vaccination at time of Corona? I guess I don't have to explain. Vaccines are really, really important. The vaccines that we now have for other diseases are an important factor in people, in reducing child mortality rates. Environmental conditions, air pollution, water pollution, climate change, sanitation, equality or inequality. Jean-Louis already said that. Population density, population mobility. All this is really, really important. If you look at these factors, you will see that income or that wealth has to do with a lot of these. Look at food. If I have no money, if I have no income, chances are I don't have food. If I don't have food, I'll die. If I don't have work, chances are I can't have good living conditions. On the other hand, if I do have work and I work a lot, chances are also that I have a high stress level. If there is a lot of work, if there's a lot of opportunities for people, maybe it comes at a price of a lot of pollution. Vaccines cost a lot of money. Developing that are really, really expensive. So where should that money come from? Again, maybe it comes from production, but then this production, what price, what environmental, what social price does this production have? In other words, this is really complicated, and everything ties into everything else. Something that I've tried to get into a graphic here in the quadrangle of sustainable health. If you put health at the center, life expectancy, infant mortality rate, disease burden, this is affected by all of these. It's affected by the economic level. You need to have some income in order to pay for the things that you need, both for myself personally, but also the society, for sanitation, for vaccines. You need some income for that. But the environment is super important, the society is super important, and probably the most important, the most difficult relation is that between the economy and the environment. How do you keep a healthy, a vibrant economy without at the same time destroying the life support systems that it needs? And this is the challenge that we have. it's actually even more complicated than this looks, because this is not a static situation, it's a dynamic process. Because it's not only true for the situation that we find today. We inherit the situations that generations before us left us. We inherit our mother's health. As I said, our birth weight. If our mothers were not well fed, our health will be compromised, and we will never be able to get totally rid of that. If our mothers drank a lot of alcohol, that also will have an effect. Our parents' living standards, their lifestyles, the societies that they experienced will have an effect on us. The cumulative economic, social, and environmental effects of past generations affect us. Similarly, what we pass on to the generations that will come after us will be important for them. Now, the way I was fed when I was pregnant has had an effect on my children. And what we leave, the economies, the social situations, and the environment that we leave to the generations after us will affect their health. This is actually also part of the explanation why we have these contradictory data, because income does not necessarily affect the lives of people living at that time. You know, if 2 generations before the foundations were set for economic growth, it probably, chances are, it had a negative effect on people living then, because they were going through a lot more stress and social disruptions. Probably we today are the beneficiaries, because that money made then probably helped finance the development of vaccines. So we are very lucky. Our generation is very lucky. Growth or no growth? This can actually be expressed in the sentence or in the question, does size matter? I would argue, yes, it does matter, but only up to a point. As important, maybe more important, is what do you do with your size? What do you do with what you have? So we want the good size, the good part of growth, of income, of wealth. We want the healthy living conditions. We want a good work-life balance. And for that, you also need income. If you're poor, you have to work all the time. You need affordable healthcare, steady income, healthy environment, the stable climate, the equality. All this is something that also requires some size, but it's the good parts of that. We don't want the bad size. We don't want the environmental destruction, not the wasteful lifestyles, not the drug abuse, the extreme health, wealth, and poverty. We don't want the damaging workloads or the social isolation. The challenge is how you get one without the other. And it's a challenge in practical terms, but sometimes also in conceptual terms. I mean, smoke and alcohol abuse is clearly a problem for health. But how much use is abuse? And who can decide? Am I allowed to tell you not to smoke? Am I allowed to tell you not to drink alcohol? Am I not? How much? I mean, these are societal questions that require discussions and societal answers. COVID-19, what have we learned there? There's a lot of things, and whole bibliographies or libraries are being written about this. I only have a few more minutes, I know. So what I think it has taught a few important lessons. One is the positive one. Drastic change is possible and at short notice. In climate change, often we hear the excuse that it's not possible, we can't change. The type of society or economy that we have is inevitable. It is not. If the stakes are high enough, we can have drastic, fundamental changes, and even at very short notice. And even globalization is not inevitable. Things can change. We have also learned that the positive effects of drastic changes are very visible around the world. I mean, I'm sure you've all seen the pictures that suddenly people see as the air is becoming clearer. My God, there's mountains there. We've never seen these. Air can be clean. That is something that in large parts of the world was something that they hadn't realized for a long time. Look at India. But we also learned that drastic change at short notice is harmful to many, many people. There have been many people who were, to whom the idea, well, the stakes or the probability that we'll die of hunger is actually a lot higher than that I will die of the disease. And this particularly applies to vulnerable groups. And I would argue this is an important point, because even if with the best of transformations of our society, even within degrowth societies, which is supposed to be much better, and something that, of course, I also want, but I find it very difficult to imagine any society in the real world that will not have vulnerable groups. So this is something that we will always have to think of, and we will always have to keep in mind. Yeah, I think I've shown that. So how do we get the health benefits? These are some ideas, but I'm sure there are many more. I would think the most important is to think comprehensively and systemically. So whatever decisions we make, and that is true for the private level, for the individual level, but also on the large level, on societal level, that we consider the short and long-term health outcomes of the policies. This is actually the same principle that the Brundtland Commission set for sustainable development. We should include teaching about that in school teaching. We shouldn't start thinking about that late in life. We should start thinking, this should just become part of our normal education as a competence that we need for lives. I think importantly, we must redesign our cities so that pedestrians have more space than bicycles and they have more space than cars. In order to do this, we need to have decentralized shopping and working and administration so we have different working conditions. We must redesign work. I would also argue we should separate healthcare from profit and from income. And these are only very few things. The rest I sort of summed up with consider available degrowth concepts, because there are a lot of concepts around, and I could just encourage everybody to go into the literature and look at some of them. Yeah. Thank you. Thank you very much.
Thank you very much, Iris. Now I'd like to give the floor to our third speaker, Panayota Kotsila. She's a political ecologist specialized in health based at the Institute for Environmental Science and Technology at the Autonomous University of Barcelona. She is currently part of research on sustainable and just cities at the Barcelona Lab for Urban Environmental Justice and Sustainability, and is also part of the We Go network on well-being, ecology, gender, and community. Panayota, I hand it over to you. You're muted.
Sorry, I thought you would unmute me. I was saying thank you very much for inviting me to this webinar. Thanks to my co-panelists who have inspired a lot of my own thinking on this topic. I'm not a degrowth scholar. I have not written on degrowth, but in my work, I often reach conclusions that lead to a degrowth argument. So today, from the point of view of political ecology and environmental justice, I will only touch on the surface of some of the issues that I find degrowth can open up to, and some of the questions that involve health and well-being that haven't been, to my knowledge, examined yet through degrowth. I don't have a presentation to share, so I will just be talking to you. Let me know if I talk too fast or if something is not understood, please. So we know from a bunch of studies, from climate change studies, degrowth, political ecology, environmental justice studies, and activism, that the imperative of unfettered economic growth which is enforced and instituted through colonial, racist, patriarchal capitalism, is damaging for human health and well-being, especially of the most vulnerable and marginalized populations. My point here is not to draw any kind of clear causal pathways or lines between economic growth like GDP increase and certain particular health impacts, right? But what I want to do is to underline that, that the imperative of growth at all costs and the political economy of that growth demands certain metabolic processes and changes that often lead to the destruction of ecological systems and exacerbate inequalities. And this set of processes is negatively impacting the health of many people, I would say the majority of people, at many levels. So Julie Livingstone called this recently the problem of self-devouring growth. And this is not to say that economic growth has not been accompanied by improvements, health improvements and betterment of health for many people, as Iris also mentioned, but this has happened in deeply unequal ways and often has involved the historical suffering and detriment of others, geographical others, social others, political others. And last but not least, good health and well-being is largely based on the invisible, unaccounted for, undervalued labor of caring for people, for nature and with nature, which has been largely unrecognized and fallen outside of the formal economy and onto the shoulders mostly of women. So in sum, the idea that without growth, in some of this introductory point, right? The idea that without growth, capitalist societies will be worse off is a mainstream idea, prevails, even if we are already experiencing vast social and health inequities worldwide. This idea is largely based on a conceptualization of human progress and development that is largely Western-led and colonial, as one way, as a linear, as there's only one way to progress as human societies. And upon this conceptualization, I think the spectrum of health is indirectly projected, right? So the idea is the more we advance in extraction, production, techno-managerial solutions that are put in place in order to sustain this growth, the healthier we will all be. But this couldn't be more misleading. And I say that because, first of all, there's power relations that operate at various scales. And it's misleading to talk about human health in general if we don't ask for whom. And second, because health threats and health risks are emerging and diversifying at a much greater speed today as a consequence of these accelerated extractions, polluting activities, and techno-managerial solutions. So obviously, if we think of like some kind of basic technological advancements, like water treatment and access to safe drinking water, or to sanitary latrines, for example, this kind of technology has benefited a lot of people. It has prevented the spread of waterborne diseases, right? We're not disagreeing with that. However, despite of this pretty basic technology, thousands, if not millions today, still lack access to clean, safe water to drink. And in fact, a waterborne disease like diarrhea is one of the 3 top causes of death in newly born babies worldwide. So we're not really lacking the technology, right? What is lacking is a better distribution of this type of knowledge and resources. And another example I wanted to, so this was from research that I have done in the context of the Mekong Delta in Vietnam. But another example from research that I'm currently supervising shows that, for example, socioeconomic factors other than GDP have a mitigating effect in reducing the incidence of a disease such as dengue fever, mosquito-borne disease, when we compare places with very similar physical geography and ecological characteristics, like the bordering regions of the US and Mexico. And this research shows really clearly that composite socioeconomic indices, which account for social and economic equality, social cohesion, transparent government, among others, can explain with much greater accuracy the difference in the spread of disease than a higher GDP or a faster increasing GDP alone can. So like Julia Stenberg also addressed in a previous talk in this series of webinars, degrowth challenges this assumption that only through growth will we be able to improve well-being for all. I think at the same time, we should be careful not to follow this kind of narrative in the reverse without problematizing it. So if growth and a colonial Western-led conceptualization of development and progress does not benefit well-being for all, then simply the lack of growth will, right? That's that because a growth mentality and over-medicalization of health and human bodies is bad, then medical science is irrelevant, or that because pharmaceutical companies are profiteering out of people's insecurity or pain or ignorance, then we're against the development of medicine. This is a slippery slope, and I think when we advocate for a degrowth framework for health, we should be careful not to fall in this reverse argument. I think degrowth should start talking more on how much medicalization, how much healthcare and health technologies is enough, and for whom and where, right? So talk more about health equity alongside ideas about slow health, community-built health alongside health empowerments, traditional health systems alongside health innovations, a plurality of health perceptions and health knowledges alongside health as shaping identities. So we should examine these types of questions and these plurality of approaches, always in context and always in consideration of our own privilege. And for that, I think Degrowth would benefit in coming to closer dialogue and collaboration, not only with environmental activists and political ecologists, but also with community health workers and medical anthropologists. So opening up these questions requires us to see and take into account socioeconomic inequality, but also things like gender dynamics and the formation of subjectivities. And it also requires questioning different perceptions of risk and taking into account, how risk is understood, health risks, what are the politics of risk discourse, how do we deal with our own vulnerabilities, our health vulnerabilities, and whether we want to eradicate them altogether, like Jean-Louis was saying, do we want more health or do we want better health? And I think there's a tension there, as the other co-panelists also stressed, between the good life and the long life. Often we use these longevity indicators to show, how well we're doing, but is this really what we should be looking at? Or maybe for whom or to what extent? The takeaway message here is that degrowth is not about stopping time or going back into time, but recognizes that development and human progress is non-linear, and it accounts for history and traditional situated knowledges, while also strives to achieve more justice in terms of well-being in ways that also account for the environment and for the planet. And I think here the concept of planetary health is also of great interest. Some of the examples that we could already look into that exist and are, let's say, maybe pilots or expressions of degrowth on the ground could be found in things like menstrual activism, drop-in support clinics, midwife-led groups pre-post birth, which help demedicalize birth as a process and parenthood, while also building kin in a community beyond the family. Learning from non-Western holistic healing approaches and practices, from convivial practices of care, from nature-based health supporting interventions or places, and what is their potential. And I think these are the kinds of cases that we need to dig deeper in context, again, always in context, and in order to draw some lessons for what a degrowth society would look like in terms of health. And I also want to agree with what the other panelists said, in that, let's say if we imagine the ecosystem, metaphorically speaking, of health institutions, there's some things that work well there and that we want more of, and some others that don't and that we want to phase out. So let's not discard progress that has been made, but rather see what of this is needed for whom, how it is distributed, and whether it is sort of brought up, let's say, in a more participatory or democratic way. And here I also want to take a couple of minutes to underline the difference, obviously, between degrowth and crisis or recessions, right? So I've read papers, some of which also Iris has led, on what was the effect of crisis on health. And they point to like reduction of mortality rate during economic crisis in Europe, another paper, reduction of rates of diabetes and cardiovascular diseases in Cuba during recession. And I think these are all very valuable observations that relate perhaps to lifestyle changes and health and their health impacts. But those lifestyle changes were forced, and for many people have meant extreme stress and extreme hardship. And I would argue, moreover, that there are a lot of other types of health impacts, like mental health impacts, long-lasting effects on health, that precarity, loss of income, or uninsured labor, crippled healthcare systems, the loss of sense of stability and of hope for the future. All of these were characteristics of the 2008 economic crisis, and they've had deep impacts on people's health. So degrowth is not synonymous to economic downturn, crisis, or austerity, although it does require the slowing down of the economy, but through a series of serene, not panicked, not emergency decisions, and requires changes that would have clear environmental guideposts with the equity and justice as pillars. So this is especially crucial, I think, to remind ourselves in the current moment of the pandemic, because what we're living now is not degrowth. Speaking of the pandemic, if I have another 5 minutes, I would like to just highlight, comment a bit on some of the links that we can draw between what we saw, the COVID-19 emergence and growth and spread into a pandemic, and growth-obsessed economies, and the lessons that we can draw from this. So the current pandemic, the current pandemic somewhat, I think, challenges this narrative of growth as synonym to well-being and better health, because exactly like Jean-Louis also said, it was born through it's a health challenge that was born through some of the most central activities of growth-obsessed economies. So a disease like COVID-19 today becomes a sort of a projection against which human health is measured, something which is problematic in itself, but I'm not going to get into this now. But it shows very well that something is not right, something we had not calculated right, that the costs of environmental destruction and social injustice are hitting back and are becoming more visible. And to be clear, I don't think that this is any kind of nature's revenge. Let's not blame it on nature. I think this disaster was clearly socially determined and did not hit us all in the same ways. But COVID-19 made it clear that there's something very dangerous in the way that we do business and that we should not go back to normal. First, and very briefly on food systems, the links between the emergence of new pathogens in general, such as COVID-19, but also other viruses like SARS, like Ebola, HIV, dengue fever, the links between the emergence of those new pathogens and the pressures that we're putting on ecosystems and on animal populations are very clear. On the one hand, we're damaging biodiversity and taking away the complexity of ecosystems, making them then much more likely to transfer disease from animals to people, from animals to other animals, and eventually to people, in combination with the expansion of human activity into habitats where these diseases proliferate in animals. And this includes things like land use change and land grabs, the change is done to benefit agro-businesses, including cutting down rainforests, burning the Amazon that we've seen recently, and so on. And third, the way we farm animals today in industrial conditions is messing with their natural bodily ecologies. Industrial farming conditions are hotspots for the emergence of new pathogens, of new viruses. So we have been creating these conditions for what is very probable events, which are zoonoses, to happen when they happen to turn catastrophic. For this, degrowth also has stressed, perhaps on the basis of other types of studies, but here now I think it becomes much more visible and urgent, the need for more local diversified agroecological systems for food production. And until we manage to transition into these kinds of systems, also we need to take into account the health of those who are working in these fields and food factories and who during this pandemic have been largely exposed to coronavirus. The second point that links perhaps ideas of degrowth with the pandemic has to do with something that was already also mentioned, the use of cars and air pollution. So I just want to highlight that intense car use and the major allocation of space for cars is affecting both the climate and our health in many ways, creating multiple vulnerabilities in light of epidemics such as COVID-19. COVID-19 is a virus that hits the lungs, the respiratory system, and thus for people who have been already very exposed to air pollution due to chronic exposure to air pollution or polluted environments in general, these people have those underlying conditions that COVID-19, let's say, takes advantage of and spreads really fast. So it's important in this regard to stress that coronavirus is a synergy of epidemics that are coming together. And these have all very clear social determinants. These underlying conditions have also been created in deeply unequal ways. For example, people of color or lower income people have been inhabiting some of the most polluted neighborhoods in cities next to big highways, next to industrial sites, with limited access to healthy food, or with limited access to public green space for recreation and physical exercise. So all of these factors come together. in this pandemic. The reduction of emissions during these times of pandemic also shows that some short-term health benefits have been achieved, but they will not necessarily last. If we help business go back to normal, so will emissions. Emissions will have to be controlled and dropped in a more controlled way, where people don't lose their jobs and people don't lose their lives in understaffed hospitals and poorly equipped care units. So to conclude this talk, I think thinking about health in the framework of degrowth and in the current situation of COVID-19 pandemic urges us to rethink the economy and to put life and care in the center, thinking of those who perform some of the most vital services in societies, like cleaners, nurses, midwives, land workers, agricultural workers, teachers, social workers, and reverse the fact that they have been often those who are less appreciated and less paid. So these are the sectors that we need to value more, to grow, while also thinking of how to make them more plural and improve them and transform them. I'm not saying that everything is perfect in these sectors. I'm saying that these are the economies within the economy that we need to sustain and support while phasing out others. Also, we need to think about the care duties that we perform at home and in our shared work space and common spaces for kids, for the elderly, for maintaining hygiene, for caring for the sick, satisfying basic needs, cooking healthy food, mending clothes, sewing masks. All these micro activities of care, which are crucial for health and for degrowth, and need to be valued and compensated and equally shared in society. So I want to invite us all to think about what kind of alternative visions of practices and of systems of health we can propose, meanwhile supporting the existing initiatives that are based on solidarity and care, which recognize and strengthen health and well-being alongside social and ecological reproduction, as the wonderful FADA collective of the feminists in Degrowth have also highlighted. Thank you very much.
Thank you very much, Panayota. Sorry about the noise. My neighbors are drilling. So before we move to questions, I'd like to invite you all to comment on the talks of the other speakers, if you have any ideas or reflections that you would like to share. Jean? Can you unmute, please, Jean?
Okay. But I let my I pass. Then maybe I will come again. No.
Okay, Panayota and Darius, do you have any comments so we can move to questions? Panayota?
There's something. Yes, thank you. There's something that I noticed in the Iris's presentation, which I just wanted to ask her about. You talked about our generation, and I wonder who are we in this our generation? I didn't grasp the graph very well. I don't know if you were referring to specific countries or parts of the world, or you know which part I'm talking about. I wonder if this our generation refers to everybody in the planet Earth, or what were you referring to?
I'm not really sure what you mean. I mean, the principle that that every generation is just one link in between generations that came before and those that come afterwards, that is true for everybody anytime. So whatever world those coming before us have left affects us, and the world that we are leaving affects those coming after us. It's actually, I put this down on the PPT. This goes back to one concept, the physio-technological evolution that Vogel and Costa have actually published quite some years ago already, saying that it is we have to look at our bodies and the social body, so to speak, comprehensively. So it's in as much as our society has changed, as the economy has changed, the technology has changed, our bodies have changed with it. We're taller now than we were 100 years ago. If you mean, I'm not sure if you mean when I said we are beneficiaries of something that came before us, That's a very good question. I basically probably mean everybody living today, although I realize that this is very differently. If I live here in Shanghai, it means something else from people if I'm living in Germany or living in Malawi. I really, to the best of my knowledge, all the data that I have seen, and they're all in consensus, really people all over the world have benefited from health, from positive developments. There are some exceptions. Something that I've written on is that in Russia in the last 20 years, and I believe in also a few other countries, life expectancy has gone down for men. So there are a few exceptions, but in the broad picture, even those reductions are very small in compared to the increases that people have developed. I have developed this in a longer article some time ago. The benefits that we have, which are that I think one of you mentioned that there are still many people who don't have enough to eat, or you mentioned that there are still more than 1 million people today who don't have sanitation, even though the technology is around. That is absolutely true. There are two buts to that, I think. The but is that in percentage of the world population, this is the lowest number ever, I believe. Maybe I shouldn't say that because, I mean, history is a very long time. So anyway, but it is a very low percentage. The element that we should not remember, that we must never forget, is population increase, population growth. In the last 200 years, the world population has increased 7-fold. That's big, that's huge. So that means that also the environmental pressure that we have, even if nothing had changed, even if we still had the technology that we had 200 years ago, the environmental pressure that we put down on the environment would be 7 times what it is then. Also, if you talk about sanitation, that is a Western concept. So if you talk about a Western type of development and that this is doing bad things around the world, sanitation comes with that. And that's also problematic, because one of the reasons that we have large parts of the world without our Western type sanitation is that it's really not beneficial. It requires a lot of water. It is not really a good idea, or not very feasible, or not practical for areas that don't have a lot of water. And so it's there's a lot of experiments going on with different ways of doing this. So simply saying there's no sanitation when we have flush toilets in mind is only informative up to a limit. I wanted to have, I know I'm talking a lot now, sorry, but maybe just one more comment on COVID-19, because I read that quite often. I really fail to see that this is a function of our economy to any large extent. I mean, pandemics are nothing new. The Spanish flu killed between 2 and 3% of the world population. We are far away from that. And certainly that was in between 1918 and 1920. We didn't have any of the globalized economy that we have today. The plague, the Black Death in the 14th century killed about between 20 and 30% of the world population. So there is not much of a causal relationship. And if we think of the last pandemics, I don't really see that it has much to do with mass agriculture, with the way we have our domestic animals. Because COVID-19 is not entirely clear where it comes from. It probably comes from bats and went through pangolins. Neither of them are domestic animals. Ebola is not entirely clear, but also is it doesn't come from mass consumption. What is certainly clear is that with an increasing, simply more people, that this does put a lot of pressure on a lot of areas in the world. There are fewer and fewer areas that people don't go into.
But maybe I could react, not on this, maybe Panagiota, you would like to, but something that you say stimulate me. No, when you said it's not the revenge of the nature, no, and it's true, but maybe not. In the sense that it's true that it's not the revenge of the nature, but we think that it is, no, because a sort of ghost in our collective unconscious is waiting this kind of nemesis, no, and I would suggest you a book to everyone of Degrowth, not well known, probably the psychological root of Degrowth, that is History of Arrogance. Luigi Zoya, psychoanalyst, Jungian psychoanalyst. He identified the psychological origin of growth in the Athens of the 5th century before Christ. You know, when there was before like the hubris, was a sort of master. You could not have the arrogance to do more, to be like a god. If you did it, Nemesis will stop you. And with different revolutions, Socrates in the philosophy, Herodotus in the history, the difference of the tragedy, the people start, the philosophy is like a thing, abstract concept, they go to the infinite, and start to stop this kind of limit and put them into the infinite, and this process has been taken by the Judaism, by the religion, and the science as make it powerful. Science has this background. The past is a sort of scene, the present is a work for a paradise. And nowadays we face the fact that the earth is not a paradise. The science is not creating a paradise, and we are suffering for an infection disease, something that we thought that was eliminated. And we see climate change, all the damages in the future, and so we lose the faith in the religion of science. And Zoya said we are waiting a nemesis, and we would have the tools for not facing this nemesis, but we are afraid because we know that we did some bad things. We did hubris, and the nemesis will come. And I think it's a good way to see what is coming, and also to interpret a lot of things that are not linked with science, but more to this kind of nemesis, the revenge of the nature, and a way to find control. Like, I don't know, in Italy, they oblige in some region to put the mask all the time in the open air, to not doing more physical activity, something that is not scientific, but is more related to give the people the illusion to have control, that science can do something. And there are rituals, probably, that they mask the ghost of the nemesis. And it's a frame that we have to keep in mind to see what will happen.
Anayota, did you want to add anything?
Well, I mean, I'll be very short because I'm aware that we're a bit late in the scheduling. But just, I guess one point that answers to Iris and to Jean-Louis is that the problem with revenge of nature and with our generation, this we, is that there's people and there's nature, and they could be antagonistic, or they could be there's a clear binary between them. This is problematic. It's problematic also, because not all people have have the same kind of contribution to environmental destruction, and not all people are bearing the costs of that. So I think we really need to break it down. We really need to think about the inequities in how in how people benefit from what you mentioned, Jean-Louis, and how other people have not. We're not all in this together. Neither growth nor COVID-19. And I think this is important to remember. Small point to the relationship of the emergence of new pathogens and Big Farm. I would just recommend a book by Rob Wallace, Big Farm Makes Big Flu. It doesn't speak of COVID-19 particularly, it was pretty prophetic. And Rob Wallace has done like years of research. I haven't. This is all from secondary readings that I've made, that I did. But I do strongly recommend his work, because he is emphasizing on how the type of agribusiness activity does increase the risk of disease emergence. And it's not about the economy per se, but the imperative for growth, right? The imperative for growth, which wants more accelerated production of food with the least possible, errors or with maximum efficiency and so on. And this can translate into other sectors. This is the problem, I think. It's not necessarily, the economy as such. The economy can be great, but what kind of economy do we want?
Thank you, Panayota. And I would like to continue the discussion with another question on narratives. So you all talked about different determinants of health, political, social, economic, but in our collective perception, health is often seen as a personal responsibility. It depends on your lifestyle, it depends on whether you wear a mask or not, whether you self-isolate or not. How can we, and these systemic factors are often overlooked, how can we challenge and change this collective narrative? Jean-Louis?
We have to deconstruct this narrative that is really the way, that biomedicine used to mask, to avoid political and social determinants. Because if it is your lifestyle, it's your fault. It's you that you want to smoke, you don't do physical activity. But the research explained that it is not, because if you born into a certain environment, if your parents were drinking, there is no job, you are stressed, you have no job, or you are working too much, you will. It's difficult to not have some lifestyle. So we have to reverse. It's good to act on lifestyle, but the best thing is to give more equality to the society, and lifestyle will change. And it's similar to what happened to education, and Illich explained it very well. The illusion that school make everything similar. So, and if you do not succeed, it's your fault. Bourdieu with the natural cultural capital explained that it's not like that. And this illusion, it's like the illusion that it's my fault if I have diabetes, because diabetes is a problem of my cell, of my lifestyle. But if it's a problem of the society that produce more and more inequalities, if we start to change the name of things, for example, Zamperini, for what happened in the G8 in Genova, he said, you have not to call it post-traumatic stress disorder. That will depoliticize. We have to call it psychotrauma. Like where the state is trauma created by the state. Not psychotrauma. Psychopolitic trauma. Is the agent is the state that torture you instead of helping you.
Thank you, Jean. Iris, there is a question from the chat for you. People asking for some.
Can I say something to that?
Sure.
First of all, masks do help. They don't cure the disease. They don't. They're not. Don't prevent the disease or the infection totally, but they do help. Secondly, there is a tension between personal responsibility and societal responsibility. And of course, lifestyles don't exist in a vacuum. But this is nothing new. I mean, this has been discussed for many, many years. And the dominant narratives change. Like in the beginning of the 20th century, people believed that it was the constitution that was very important. Then in the 70s, it was the society was very much emphasized. Then it was the personal responsibility more emphasized. They all play a role to some extent. I mean, obviously, it is really, really important to talk about the social implications. If we want to change that, we have to talk about that. So I'm not against that at all, and I also totally agree with Panajota that we're not all in this together in the sense that everybody is equally affected. And we saw that in COVID-19 very clearly, that that there are vulnerable groups, and there are minorities, and there are migrant workers, and there are women, and we see that with health in general. That is absolutely true. I have one problem with that. If we say society, or if we say the system, there is only a very small step to saying, well, it's nobody's fault. Because who makes the decision in society? Many people, not many people in the world, but people in some countries can vote. Or the other question is, if it's society that is at fault, so what? What are you planning to do about it? Huh?
It's a bit everybody fault with different piece of cake. Someone more, but everybody, I would say, not no one, everybody. To take.
Well, but that's the problem. If it's everybody, I mean, I don't really disagree with you, not totally, but a little bit, because I have students like that. You know, I have students telling me, well, there's nothing I can do about it. It's no, it's everybody. And I think it's important to be aware of where we are, where we fit in. And of course, society has an important impact on how we live, on our lifestyles. But our lifestyles also has an important impact on society. I mean, it is this, it's the mutual interaction between, on the one hand, governments and voters. So you can have the best ideas of how you want to transform your society. If you don't have a party that will do that, or you don't have politicians that you can vote for, there's nothing you can do as a voter. But if you have a party and you have the best ideas, but they will cost money, and nobody votes for you, you can also not do anything. I mean, we've had examples of that in Germany. So everybody is at fault, and you have the same difference between, on the one hand, you know, producers and consumers. I had this discussion at a conference. Same thing, same argument. So I think it's you know, you always come back with the same arguments. And the question is, as we were discussing, and they were having plastic bottles with mineral water. And the question is, why were there these plastic bottles with mineral water? And I ask this not as a rhetorical question, as a real question. Now, everybody knows that plastic bottles are not good for the environment. Everybody knows that. Everybody at the conference know that. So is that the fault of the producer who put the water in the bottles and selling it, making money out of it, making profits from that?
Sorry, Iris, I think I'll have to cut you a little bit because we're running close to our running out of time slowly. Panayota, you wanted to add something to this, and maybe you could also address one of the questions from the chat. The question is, what is slow health? What do you mean by this?
Thank you. Yes, very quickly, because I strongly disagree with this idea of either, you know, I go vote every 4 years, or I don't have a say in what is happening around me or with my body.
No, that's not what I said.
Right.
That's not what I meant.
What I'm trying to say is that there's many ways to influence what is happening. There's many ways to be part of decisions taken. The question is not pointing the finger at who is responsible. It is part of it is pointing the finger, because we need to think also of scale, right? So if I have a biodegradable toothbrush versus a plastic one has a much lesser impact than, you know, fossil fuel extraction, than gold mining, than other types of like activities that their impact of which is massive. I think individualizing health responsibilities or even environmentalism, individualizing this is part of a neoliberal ideology that tends to take away, you know, responsibility from structures and social structures that have been there, and this is the reason why they exist. And also taking away responsibility from those who profit from these kinds of activities. So I agree with what was said in that our lifestyles matter, but when we speak of justice, we're speaking of giving everybody a fair chance to live a fulfilled life. So if people are lacking this fair chance, this fair opportunity to be able to make those decisions that will make them healthy or that will pollute their environment less, then they are experiencing, they're part of an injustice and they cannot control that, you know. So I think this comes back to my point earlier on that we are not all the same. We are not all in the same positions. There's a line of privilege, yeah, just to clarify that point. So then let's go to the question from the audience, the slow health. What is slow health? I can't give a very concrete answer now because I haven't really delved into it much in depth. But a slow health would be health that is more, approach to health would be health that is more holistic, that takes into account, you know, not the particular moment where you're experiencing some kind of sickness or a disease, but rather looking at the looking at a person, at a body more holistically in terms of lifestyle, in terms of life trajectory, in terms of a social cultural environment, and thus taking decisions that have to do with health or cure in a way that is not instant, that not necessarily is about curing something now, but rather creating those conditions that will help the body and the person recover. This is a very simple answer, but I invite the other co-panelists, if they know more of it, to also contribute, or else I'm going to look up more and post in the chat.
That sounds very much like the definition of the WHO.
Okay, I'd like to pick up, Jean-Louis, did you want to add anything? No? Okay, I'd like to continue with another question related to responsibility. What could be the role of pharmaceutical companies in sustainable healthcare system? And there is also a related question coming from the chat. The viewer is referring to the impulse to help others that's driving people involved in the pharmaceutical industry. Jean-Louis, would you like to comment on that? And maybe I would also like to add another question on more is not always better and the watersheds that Aillon spoke about. How do we define which level of healthcare is enough, and who defines that?
I didn't catch the second. Can you briefly repeat, please?
The second question was about the watersheds that Aillon spoke about, and the idea of more is not always better, more healthcare is always better. How do we define what is the sufficient level of healthcare services and health in general, and who can define this?
Okay. Allora, there is again, the pharmaceutical company, we would have to probably put some limits, no? And I don't know, you know that pharmaceutical company invest 2/3 of their budget on advertisement. No, that's full. No, you don't need advertisement to science papers that tell you what you do. No, probably we could use tax. I don't know this money and use it to promote virtuous programs like sustainable healthcare, or invest in social determinant of health, And also is what we write also with Iris, there is the need also to a national development of drug that is not responding only to the market, but to the need of society. Could be an answer. And then also to do more strict rule about conflict of interest. That is a big virus that produce the creation of disease. So to put some limits. In medicine, we have a word that normally tell us when a cure is appropriate. And for example, if you have a flu, a problem to an angina, I don't know the term, a pharyngitis, and if it's viral, antibiotics are useless. They make you pain or problems, and so they are not appropriate in viral form, because they make danger. Similarly, I don't know if you go in Italy, more than 50% of the X-ray are inappropriate. In the sense that we do not need, and so we harm the patient because we do X-ray that are not good for health, not for a reason, but just because we have to do like this commodification of things. More is better. No, sometimes if you have fever is the best, also for COVID, the best mechanism of defense against virus, bacteria. So if it's not more than 39, you can take, and you will also protect the other because you will heal before, and so it's not appropriate to use just paracetamol if you have 37, 38 degrees, if you are not really painful. So it's a bit the measure. And for example, if the person that asked the question want to see, there is a campaign that Slow Medicine in Italy is doing, and the campaign International Choosing Wild is that is followed by really maybe 100 association of different specialities, and every specialty, so psychiatry, cardiology, tell what they are the 5 more practice that are not appropriate. So then we do, but there is not evidence enough that is good, but is harmful. So that could be one way to look at it. The other way is more complex, because Illich, when look at the damages, is not just look at the clinical point of view, but from a societal cultural point of view. How can we measure the fact that now people cannot stay with sufferance, cannot stay with death? They delegate cure to the doctor. This social mechanism of control that prevent ourselves to know that is a sort of genocide. Every year, 13 million of people that die, for destroying the environment, for what Pasolini calls the fascism of consumerism, and is also not only linked with some mechanisms that the medicine contribute to promote. Then it's not medicine is important, but we will like with Grow, we will have to try to keep the good part of medicine and to avoid these inappropriate uses, and generally to promote in a lot of area when it's needed demedicalization.
Thank you, Jean. Iris, I would like to return to you with a question from the chat about the data on the paradox between economic recession and improved health. People asking what could explain this improvement in health while economy is in crisis and recession. Could it be that people become more self-reliant, they produce their own food and engage in practices alternative to capitalist commercial practices?
Can I have a few sentences about the pharmaceutical industry?
Sure.
because I think one question was, what is the urge to help in the pharmaceutical industry? The short answer to that is that's not there. The pharmaceutical industry makes a lot of money, so, and it is very ineffective. As you said, most of the money goes to commercializing, to advertising. But in a sense, I feel that's almost not their fault, because it's, you know, if you privatize the production of medicine, that's what you get. So if we don't want that, if we want a public system, which I would probably want, but then we have to live with the consequences of that as well. So then again, there's the question, who decides that? We would be saving a lot of money that does not go into advertising, a lot of money that doesn't go into these Me Too drugs, that because one company produces them, the other company also wants to produce them. So probably, you know, that's why I would probably be in favor of that. But what we would be getting different types of problems. So at the moment, we get a lot of drugs for minor ailments for people in high-income countries. We get very few drugs for many people in low-income countries. I'm not sure that would really be changed, because, you know, how many people in Italy or in Germany or in the US, how much money would voters there be prepared, or would Congress, would Parliament there be prepared to put up for diseases that does not apply to their countries? Maybe they would, maybe I'm too negative, but it's you know, if I think of that since the 1970s, countries have promised to give 0.7% of their GDP to development aid, and very, very few countries do. I wouldn't be overly optimistic. So it's okay, just that. What's the explanation? The short answer to that is also, we don't really know very much. I mean, there are people who've been studying that for decades, basically. There's Tapia Granados, there's Rum. I can, you know, put some, I think I did put some publications up. There are some theories on that. Probably the most important reason is the social disruption. In times of economic growth, there is more work, so people have more stress. So when there's less work, unemployment is unhealthy. We know that. People do have more stress, and there's more, and suicide is the one cause of death that goes up. But on a societal level, there is more people who have more leisurely workspace or work speed, life speed. The general speed goes down. So we know that there is fewer heart attacks. That can be shown in the data. There's fewer people who die of car traffic accidents. So there's fewer people on the road. There is probably more time for socializing for many people. So those are some of the reasons that people put up as reasons. The most important reason actually is not so much that life gets better during a crisis, because it doesn't, but that the negatives of economic growth are not there. However, having said that, also, it is not always true. You also find crises in which health deteriorates. Not every crisis is the same. The basic importance is, does the healthcare system or do basic social services remain intact? If the whole country, if the whole system breaks down, then this is not good for health either.
Thank you, Iris. I would like to pose, I hear some echo, some horrible echo. Thank you. So I'd like to pose one last question to Panayota. You mentioned creating synergies and dialogue between Western medicine and traditional, what we would call alternative medicine, but how is it possible given their intrinsic differences? Do you have any examples of successful implementation and combination of two?
Yeah, that's a really good question. I think it also links to the previous question of what is enough. because as I said before, enough is different, means different things to different people. So I think maybe it's better to talk through an example. As I said, I studied water access, water supply and sanitation in Vietnam. In Vietnam, there's traditional Vietnamese medicine, and there's a big tradition of that. It still exists, like it is institutional there. Like there's a traditional Vietnamese medicine hospital, and they studied at the medical university there. What we see there is that a lot of the, let's say, a lot of the knowledge that comes from Western medicine, the way it is transferred and brokered down to the people in the rural and urban areas of the Mekong Delta is done in a very authoritarian top-down way that, of course, we have to take into account, you know, the political context there of the Party of Vietnam, but not getting into the details. People feel it's their moral obligation to modernize their health perceptions and understandings and to follow the ideas of Western medicine that comes to them either through NGOs or through the state. And therefore, when this becomes a moral imperative, if you can't fulfill that, if you can't afford to have a latrine, a flush latrine, or if you can't, or if you can't change your cultural habits at the required speed, then this creates a contradiction of what, it creates a subjectivity and conflict. It creates, families told me, women told me, yes, I do this. Yes, I never in my house have we had diarrhea. And I struggled 6 months to realize that this was not true. And they were not lying to me because they didn't want to tell me the truth. They were lying to me because there was a stigma in saying that I got sick from something that the state says I shouldn't be getting sick, or for which I had gotten educational material or a lecture one time a year ago. So what I'm trying to say is that when we're talking about importing Western medicine and trying to inform societies that maybe have different kinds of knowledge around health, the key is to do it in a way that is empowering for people and not to scratch off whatever other types of knowledge exists and narratives about health. And the same can go for what causes disease, not just for what cures it. So people have their own understanding and experience, and it's valid knowledge. Sometimes it might be contradictory, but if we understand, and if we understand together why this appears to be contradictory, then maybe some common understanding might arise. So I think working together with people rather than as experts versus, the ignorant mass is key. And the other way around, then how do we get inspired by non-Western and traditional knowledge here in the West? I don't think there's much of a problem there as long as we don't turn dogmatic, because I've also seen, a lot of collectives and people talking of, as I said, discarding everything that Western medicine has done and saying, oh, I'm just going to drink this tea and this will cure all my diseases, So dogmatism is bad, both in trying to impose a certain set of knowledges onto people, but also when we're trying to get inspired by others. And I think the role of medical workers is key, and of that work with communities, and the role of doctors that are working past their authority of I know everything. Yeah, so doctors who work together into different approaches to health, like we said before, like slow medicine or more holistic medicine approaches. So I hope that answers the question. It's a very complex question.
Thank you very much, Panayota. So yeah, we're running out of time, so I'd like each of you to make some final remarks, and maybe we could incorporate one of the questions from the chat, which asks if we could prioritize the pursuit of contentment over that of happiness.
Sorry, can you repeat that? This is a question that we address now, or?
I don't understand now.
Yeah, I'm asking you just to make a final remarks, and you can address this comment from the chat, but if you don't like it, you can ignore it. The question is, what might be persuasive selling points to the public for prioritizing the pursuit of contentment, as per Amartya Sen, over that of happiness?
I let the others answer. Could you pass it in the chat, because I have difficult to understand? Thanks.
Sure.
I guess the person that asked it should maybe clarify how they understand the difference between contentment and happiness. Is it a more of an instant versus long term, or something of a gratification feeling of happiness versus something more like something that comes from creating something? That is, I don't really know. I don't think I understand the difference in how the two concepts are posed here.
Iris, you muted.
Of course, I don't really know what the question meant really either, but I know there's a lot of research going on happiness. It has been going on for some time. I guess maybe at the last point I could point to the Happy Planet Index. That's what I think of. So I don't know if you're familiar with that. It's the New Economics Foundation that came up with this index, I guess about 10 years ago or so. I'm saying, well, GDP is clearly not measuring what we want to measure. And it's keep growing GDP is not getting us where we want to be. So the question is, where do we want to be? What do we want to measure? And they said, well, what we really want is to have long, happy lives without destroying our planet. And that's what they measured with the Happy Planet Index. So it's life expectancy times self-decided happiness. So on a scale of 1 to 10, how happy are you? Divided by the ecological footprint. And for the last 5 or 6 years, they have given a social gradient to that as well. So it's the inequality adjusted Happy Planet Index, which is worth looking at if we want to see where we want to go. And health is in there somewhere, happiness is in there, and long life expectancy is in there. So I guess it belongs to our talk.
Thank you, Iris. Jean-Louis?
Maybe I arrived to understand better. And as I can say, happiness is a subjective indicator, no? Maybe, I don't know, a lot of people in America would be happy to work more and more, to be stressed, to have power, and more they have, more they will be happy, no? And for us, could be a misleading indicator, no? Why probably contentment or Latouche speak about serenity or health are more some indicator than, I don't know, serenity. No, I can not necessarily to be happy, but I am serene also in pain, also in difficulty. No, and it's why the definition of World WHO is also questionable. No, complete state of serenity, well-being, physical. When in your life, 5 minutes, 1 hour, you know. So probably contentment or some indicator that are not just subjective and oh, I happy, boom, boom, would be more appropriate for a degrowth and to be authentic in relation also to the sufferance, to the pain, and not to remove them away. And I would say.
Thank you, Jean.
And generally, no, if I have time, last thing, turning back to a debate that was before, I think that there is a tension now in degrowth between changing lifestyle and changing the society. Is what we call hermeneutical circle. The society produce men, the men produce things that change society. And for example, we had a lot of debate in the Nectar of Health and Sustainability at the beginning between degrowth that we announced to change lifestyle, decolonize your imaginary, see that to go slow is better, relationship, not just money, etc. why a lot of people in some determinant of health association, no, it's the structure, it's the society. And I think we have to act on both the level. No, it's good to try to decolonize imaginary, to promote changes in now the daily life that are also political acts, doing good urban gardening with your community met, doing things, no, is doing politics, is to take this responsibility. But there is also the question that some people, I could speak with them and maybe probably they will not understand. And so we have to balance the starting point to make more easy to people to change their lifestyle. Sorry for the long, but thanks.
Thank you, Jean. Panayota, would you like to address this question or you have any other comments? Feel free to.
Happiness and contentment.
You can say whatever you want.
I mean, I think one thing that comes to my mind is maybe that happiness is something that we have been fed much more as a word. So people might think certain things as what happy is, and that are socially structured, the idea of happiness, which are very normative, right? They're mainstream, but contentment to me reads more as something more meaningful. So yeah, I think it relates back to, if I try to link it to health, to this concept of better health rather than more health, and better living rather than, I don't know, necessarily more affluent living or you know, forever young kind of ideas. So I tend to, I also agree very much with what Jean-Louis said about embracing our vulnerabilities, and because only if we do that, we'll be able to value the care work that is being done when we're sick. We cannot avoid sickness, but what we can do is, I mean, obviously we can control it, and we can avoid unnecessary loss of life, et cetera, and we can mend pain and so on. But this idea that we can be healthy forever, or that there is a status of healthiness and that disease or sickness is the exception, I think is problematic. I think that that it kind of you know, it creates this imaginary of a human being that is strong, that doesn't need anybody, is independent, it can care for itself. It doesn't need any kind of supportive structures around them, and this is also very, let's say, a kind of a, well, anyway, I'm not going to expand more on this. I think it's important to value our vulnerability as part of our humanity.
That's a great point. Thank you, Panayota. So we're going to wrap up, and I would like to thank our speakers for joining us today. It was a very interesting discussion, and I would also like to thank the audience for watching us. And I'd like to remind that there is another webinar at 6 p.m. UK time, in which we'll discuss the role of the state in the Degrowth project. And there will be more webinars coming in the second half of June. Thanks, everyone. Bye-bye.
Bye-bye.
Thank you. Bye.
Bye-bye.